Well, we've been talking an awful lot about the doctors on the front lines of this COVID-19 pandemic, and some of the doctors who've also been waiting to go do their jobs as surgeons and other kinds of medical treatments that have been necessary for so many people. And Dr. Avital Harari, of course, is a regular contributor to Carlos and Lisa, who joins us now. Nice to have you with us. It's been a long time, and you've been very busy. How are you coping?
We're doing okay. We're hanging in there. It's a difficult time, I think, for everybody. Yeah.
It's especially difficult for doctors, and tell me why.
Yeah, I mean, doctors, all the doctors of all types, the ones that are on the immediate front lines, the ones that are behind the scenes, everybody's struggling right now. Obviously, you've heard a lot about the frontline workers and how difficult it has been for those physicians, not only to deal with death and disease as they have had to do every day, all the time, especially my colleagues in New York City, but really just having to deal with the amount of people coming in, they themselves getting sick, the fear of that happening and bringing it to their families. And it's not something that only those people are feeling. All the physicians throughout the hospital system are feeling this as well. And we're all kind of affected by it. I, as a surgeon, we had to stop a lot of our elective procedures in order to make room for in the hospitals for potential surges for COVID patients, so that the patients would have a place to go, they'd have a bed, so that we can extend our ICUs as far as we needed to. And this happened across the country. The American College of Surgeons suggested that this happened over a month ago. So we've been doing that in preparation. And certain cities have seen different amounts of patients and different surges and different the disease has hit the cities a little bit differently, but we all kind of agreed that this was the best situation. And some of it also has to do with providing PPE for the physicians that are frontline and in the ER and in the ICUs, and also those of us that are treating and doing procedures emergently. So I do that as well. So I have to wear my PPE with certain precautions with different patients depending on the urgency.
So let me ask you, Avital, because you have children at home, and you're a surgeon, and you've been trained. You understand infection. You understand the necessary protocols to keep everybody safe around you in this environment. How is this different from any other infection that you've ever had to deal with?
This is sort of a terrifying infection, to be honest. It's the reason it's so different is that nobody has ever been exposed to it. And so there's no one who's immune to it. And even though, the common cold is typically caused by a coronavirus, a different type of coronavirus, those are pretty mild infections. The thing that makes this infection so unique is that it transfers like the common cold, but it is so much more severe than, it's about 10 times the death rate of the flu. And it's not even just the deaths we're talking about. It's the morbidities. It's the people being admitted to the hospitals. I mean, there's about what they think of those people who are symptomatic, about a 20% admission rate to the hospitals. And that's a lot of people. And that can overwhelm the healthcare system. And the other thing that's important to know about this, as opposed to the flu, which we get vaccines for every year, which at least partially immunize us, this is something that we have no vaccine for. We also don't know if there are effective treatments yet. They're doing lots and lots of trials on both vaccines and treatments, which is great. But until we have one or the other, we're going to have to continue practicing all the safe social distancing practices, and depending on the city.
So I'm curious about that because, what are you telling your children? How are you interacting with your family? And tell me that dynamic.
So I'm trying not to alarm the children. I mean, my kids are both 5 and 3, right? So they have a little bit of a brain on them, as you can imagine.
Yeah.
And
their mother, smartest woman I know.
Of course, they're curious. We've kind of called it the bug. That's sort of what they've called it. So I've rolled with that. And, and just in simplest terms, they know about getting sick. They know about getting a cold. They know about all those things. And I've kind of just I discussed with them early on, being as honest as possible with them about why we can't see their friends and why we can't go back to school and why, we have to wear masks certain places outside and why they can't leave home or the area around our home. And fortunately, we have places to walk around. We have a backyard, but it takes a toll. And I think about it all the time, especially now into the 5th, 6th weeks of doing shelter in home. I worry about what happens mentally to kids that think of, what happens when we open things up? Are they going to be scared about leaving? Is this bug gone? The 3-year-old, I think he's not going to remember much of this unless, I think this might be an issue again next winter. But the 5-year-old will remember. And I think we just have to talk really honestly with them. And I think they're going to, I've shown them little videos about germs and things like that, but it is hard. It is hard. And personally, I'm a teacher now. I've become a preschool teacher and a TK teacher along with my surgical duties. And that's always fun. But it's actually, one thing about this that has been really nice is being with my kids as much as I've been able to be with them, which is much more than I normally would. And being able to teach one-on-one, especially my 5-year-old with, it has a lot more robust curriculum, but it's amazing to see his brain and the way he thinks. And so our bond has become really close. But the opposite of that is true. They're going stir crazy. They're 5 and 3-year-old boys.
Yeah.
So they're out of control. And so we're like having to balance the dynamic. Yeah. And I will say my husband works from home too. So the whole family is here. We fight for the office a lot. But, I do, because I'm only going in for urgent surgeries, I don't have to go in too often, although, they're opening things up a little bit now. I don't know if you want to hear about that, but
let's leave that for another time. But
yeah,
I'm grateful for your time, and I appreciate what you're doing for us and for everyone around you, and especially for what the sacrifice that your family's making. But I wish you well. I wish you Godspeed and continued happiness. And you know what? To all the frontline people out there, your friends in New York and friends here in LA. Of course, our thoughts and prayers with them, that they'll be strengthened through all this and that we'll all get through this and out the other end with who knows what, right? Masks, gloves, who knows?
Yeah.
Yeah. Great to be with you, Avital. Thank you so much.
Stay safe.